here with Dr. Janet O'Ryan, and she's going to demonstrate for us how a chiropractor would test appropriate action.
Well, a lot of chiropractors know muscle response testing, and if you do, I'm hoping that you'll pick up a couple of tips of things that you might not be doing now that you could be doing. And if you haven't started using muscle testing, the whole purpose of what we're putting together here for you is a simple home study course, which also includes a mini course in how to do muscle response testing, which I will demonstrate, and kinesiology with something like a pendulum or a little strand of pearls or something. So Garen, could I show people what a chiropractor can find out about someone?
Yeah.
Using muscle testing. Well, you obviously have already taken a history and you know why they're there. So muscle testing, what you want to do is have them look straight forward so that they're not engaging other factors, and they're holding their own arm up. And I like to use the right arm, but I could use the left arm. I could do any position that works. It doesn't really matter. In fact, I'm just going to do this. Most people do this, and there's a lot to be said for this posture. But let me just show you this for simplicity. So hold. So I just asked him in the clear to hold, and it locks, it engages, it's solid. So now I'm going to do a few tests to see if his biocomputer, for lack of a better word, is on, if it's responsive, and if it's communicating. So I'm going to say, hold, test in the clear always, show me a yes. Stayed strong. Show me a no. You know the difference there? Yeah. It actually, it doesn't engage and lock. Both of those are normal, by the way. Now, this is a test to see if someone is adequately hydrated. And he stayed strong, so he is. What you do is you pull the hair, and within 3 seconds you test a muscle that's strong and see if it stays strong, which indicates no response to that challenge. Or if it goes weak, like imagine being in the desert, haven't had any water for a couple of days, they would go weak. That would be like a blip on the screen going, ooh, water, nerve endings, irritated, thirsty, crash. So those are really important things to test right at the beginning, especially as a chiropractor, because if your client, your patient, is not adequately hydrated, discs in a young person are 88% water, as you know. So if they're dehydrated, the body's going to squeeze water out of non-essential tissues like cartilage, like discs, to keep enough water in circulation so your blood doesn't clot, or your kidneys and your liver can function. So if somebody's getting shorter as they're getting older, it's because they're dehydrated. And it's not just because of not enough water. It could be quality of water. It could be what they're eating, what they're drinking. It could make them either not be able to get enough water because the body is trying so hard to flush something out, or the kind of work and environment they are in would require more water. So we know that Garen is adequately hydrated. So I'm testing in the clear again, and he's strong. That's normal. I'm going to look to see if he has like an urgent or acute issue. It's kind of like a smoke alarm going off. And the way I do that is I check. Oh, no response. Strong muscle stayed strong. Let me see this here. Really hold. Strong muscle stayed strong. So these hand chakras are like the scanner of your body, and if you have something that is urgent that needs to be handled, when you contact that and test, you get a shift in muscle phase. If it was strong, it'll go weak. If it was weak, it'll go strong. Strong is not necessarily good, weak is not necessarily bad. So I know that Garen does not have an urgent or acute issue. Now we could create one. Let's tune in to someone who just ate something that was contaminated and they're starting to feel a little bit sick. We're just going to pretend that that's going on. So we're going to tap that into Garen right now. Hold. And that went in. Now he's being a radio station for another situation. So now when I test hydration, he's not adequately hydrated. Hold. And in the clear, he was in weakness, which means we got to get some water to him. That's the end of the first step. Let's drink some good quality water. So let's imagine you're drinking some really good quality water, and you imagination and reality are pretty much recognized by the subconscious mind as the same thing. Okay, and he's still not adequately hydrated. Great, and I'm just tapping up the computer processing centers along the conception vessel meridian. And hold. So does Garen need more water? No. Does he need to stop eating things like that? 12 strong is a yes. Show me a yes, show me a no. Does he need more water right now? No. Does he need to stop eating things like that? Yes. So will you agree to do that? Great. And test your food before you eat it? So we tap that in. He registered that. He's back in strength. Let me see your other hand. No acute issue. And he's adequately hydrated. We could go back and see if he still had an acute issue in this scenario that we just went through, but we already know he ate something. And show me your response to what you just ate. You see your arm? Weak, 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 weak. That means mediocre. It means, think about if it sat around and spoiled for 2 more weeks. Strong, 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 strong. That's like, get that away from me. And hold here. He went to completion, and we're going to erase and tap out of that whole scenario because we don't want any of that registering in our being. So there's ways you can test your client to see are they adequately hydrated. Once you get past that, then you can find out, well, what can I do for this person today?